Hello, everybody. Welcome to the Boss Body Podcast. I'm Sarah Haas, your host, and I am really excited today because I have a special guest. She is a very close friend of mine, Dr. Amanda Dove, who is a general practitioner. And we're going to talk to you today about diet pills and some of the things that she sees in her practice and try to give you some advice if you are seeking different weight loss options. So, Amanda, thank you so much for being here.
Thanks for having me.
It's weird seeing you on Zoom. I usually see you in person.
I know. Well, you actually get to see me, not working out and all made up.
All glammed up. So, Amanda is a workout client of mine. We've been working out together for years. I don't even want to think how many years it has
Yeah,
been.
don't dwell on that.
We don't want to age ourselves.
Right.
But anyway, so Amanda, you are a family doctor, correct? So you see all different ages, types of patients with different ailments, issues, that kind of thing, correct?
Exactly. The old cliche is from womb to tomb. So I try to deal with everything between those two poles.
Right. Right.
One thing I'll say, I definitely don't want to make it seem like I represent all doctors or any particular type of doctor, but you may hear a little of maybe something you've experienced. If you've gone to your doctor to ask for help with your weight, you may think that definitely happened to me, because we do get similar training. Family doctors and internists who do general health care get a pretty standard training.
Right.
And well, let me just give you a scenario and you see if it applies to you. So you've got 40, 50 pounds to lose. And the first place you go is to get a physical to make sure you're healthy. All right.
Which is
Your
a good
insurance pays
thing.
for it.
Yes.
It's a good thing. You should absolutely start with physical and get some numbers and make sure everything's good before you embark on any big change. So that's great. You've gone and your insurance is going to pay for it. So it's an affordable way to start. And you do your labs and you get checked out. And at the end of the visit, you say, okay, I've tried everything. I've done this diet and that diet and this exercise program and this herbal supplement, and maybe I'll lose a little weight, but it comes right back and more. And maybe you had babies and there's weight from that you just can't get to move. Or
Or
maybe
you've
you've
grown
gone through
older and
menopause.
yeah. Yeah. And it's so common, the losing and gaining. It's just so frustrating for so many women.
And you would think that medicine would have come up with something that they could give you to help with that.
Because excess weight is a medical issue and it has medical repercussions.
100%. It's the main cause of morbidity and mortality, or suffering and death, especially in America. It should be our number one priority of research, but it's kind of not. So you might have heard something like, well, okay, I'm going to give you some sample diets. Those are all probably calorie restrictive diets, 1,200 calories or less. Maybe they're diabetic diets. Maybe you're not diabetic, so you're wondering, why am I getting this? And some of the literature is branded. It's got maybe a drug name on it, and it's all pre-printed, and they hand you this little stack of papers. And you say, well, are there any maybe medicines that could help me? Because I've tried all this before. And they say first, well, not really. Or maybe they say, there are some pills we can try, but I don't think they're great. I'll give them to you if you want. And
do you get a lot of people asking for the pills? Because we see the ads on TV and we hear all these weight loss success stories, and it makes it seem like, oh, wow, that's a lot easier than exercising and changing my diet. So why don't I go to my doctor and get a pill?
100%. It's so common that I can almost predict it by the way a person's voice, their tone is,
Oh, wow.
And they've maybe talked to a coworker or a family member and they've said, well, I tried this and this helped. Well, you might get those pills and you might get about 2 minutes worth of explanation on how to use it, and out the door you go.
Right.
And maybe you'll go back in 6 months for another checkup. You won't get any support between or advice or, hey, how's it going?
Mm-hmm.
And this is something I know you talk about a lot, about the actual day-to-day support to keep your health where it needs to be to achieve a goal. It
Right.
doesn't happen in a vacuum.
And your doctor, it's nothing against the medical profession, but that's not how you're set up. You don't have time to do that because you're dealing with people that have heart problems and people who, you like you said, the whole gamut of different medical issues. So you don't have time to give that person what they need if weight loss is what they're looking for, because that's not where your specialty lies.
That's a really good point. That isn't where our specialty lies. And unless you've sought out a physician that has specialized training, and there are some out there that are really good at this, but in general, not really.
Yeah.
I was thinking back this morning, what training did I get in medical school for nutrition and health, preventative type things? And it basically boils down to 4 weeks of 1 hour a week lecture of
Wow.
pretty archaic material on nutrition, food pyramid stuff, things that we really don't even use anymore.
Yeah.
And that was what the whole class got. So everybody in that class maybe went to a different specialty. So it's throughout the medical world that's how you lose weight. Cut calories, exercise more, and it'll happen. We all know
Right.
I wish it did. It doesn't. Then in residency, and I mean, our focus is a lot of preventative health, and I still maybe got 2 or 3 lectures from anyone trained in nutrition and preventative healthcare. You were
Yeah.
just kind of expected to train yourself, and that's what you get when you show up at your doctor with your insurance card for your physical.
Right.
So
Yeah.
it's disappointing.
And like you said, this was whenever you went to medical school, which could be
Yeah,
20 years ago, could be 40 years ago,
could
depending
be
on,
yesterday.
yeah, depending on the doctor. And so whatever
True.
they learned at that time, they could still be thinking that that applies to today when we know the science has, changed and we understand it a lot better. And you, as a physician, don't have time to keep up with all the science about nutrition
No.
because you've got to keep up with diabetes and heart disease and cancer and COVID.
And fortunately, our day is timed. Everyone's day is timed, but in the medical world, it's how many can you see in one day? How many people can you help and get their needs met as efficiently as you can?
Mhm.
So sometimes you end up giving out pills for something that pills are not appropriate for, and
Mhm.
weight loss is way up there on that list.
Yeah. So what about the pills? Because there are weight loss centers. There are doctors who specifically work with people and do pills and shots and,
Mhm.
the HCG and the phentermine and all of those. And we see success stories. We see people like before and after on the commercials and they've dropped 60 pounds. And that's makes it very, very tempting if you're struggling and you just want to lose the weight and you want it gone. So what do you see as
That
the
is
issue with
true.
that? Why are you not a fan of
Anything that seems too good to be true is, so that applies across the board.
Yes.
And the things in general that are used in weight loss clinics and doctors' offices help you lose weight by speeding up your metabolism and helping you restrict your calorie intake by
Which
suppressing your
sounds very
appetite.
tempting. It sounds
Sure.
like on the surface like, "Hey, that's what I want. I want my metabolism sped up and I want to eat less."
And it will work for most people for a very short time.
Right.
And sometimes that short time is weeks.
Mhm.
Sometimes it's a few months.
Mhm.
And the other drawback is if you don't continue taking these medicines and restricting these calories, which I know you've touched on, where calorie restriction can't be maintained. Your body does not work that way. It
No.
constantly
You can't
adapts.
live in a period of starvation.
It's not healthy. Well, once
No.
you stop that or you just give up, the weight comes roaring back in a big
Yeah.
way, usually much more than you lost to begin with.
Yeah. So it's just absolutely not a sustainable way to lose weight.
The
And then,
general medicines that are used are stimulants from a
mm,
family related to things you may have heard of, like Adderall or Ritalin, or even the decongestants you use when you have a cold. They're in the same chemical structure. So, yeah,
really,
they speed up your heart rate, they speed up your breathing, which burns
mm,
calories. Along with those things, for some, if not most, can come anxiety, nervousness, insomnia, dry mouth.
awesome.
Yeah. So you're already upset about your weight.
Yeah.
Let's add a little to that.
But some people, I can hear the wheels turning, are like, who cares? I don't care if I have a
Right.
speed up heart rate. I don't care if I'm anxious. If
Yeah,
it causes me to drop the weight, let me have it.
sure. And I've been there. I think
Mhm.
many of us would be honest and admit we felt that way.
Yeah.
And you also should keep in the back of your mind that these medicines aren't without long-term problems.
Yeah.
So we talked about when you stop the medicine and you go back to close to your regular way of eating, weight comes back. Not only does that happen, your metabolism is foundationally different now that you've taken these medicines for a while.
Hmm.
So what you did to lose weight probably won't ever work again. So what's our next step? A lot of folks end up in the bariatric surgery world after taking these type of medicines because the tricks you use to get your body to drop pounds before no longer work, no
So
matter
you
how hard you try.
fundamentally changed your metabolism for the worse.
Yeah,
And don't they have a lot of other negative side effects as well, just for your health
sure.
in general?
It can cause high blood pressure, and sometimes that doesn't go away. And we all know what can happen with high blood pressure. Lots of organ damage and other problems can occur. And these are the worst case scenarios. A lot of folks do take these medicines and they feel okay afterward. But in general, they're pretty damaging for folks. Well,
Hmm.
why are they offered? Well, they're approved by the FDA and they make money.
They make money. There it is. The bottom
It's
line.
all about
The
money.
diet industry they want you to fail because you'll keep trying and buying things and laying your
Yes,
money down out of desperation.
you got it.
And it's funny as we're talking about this, it occurs to me like if there really was a magic pill out there, if there really was one shot you could take, we'd all be at our ideal weight.
Exactly.
We would have it one and done.
Mhm.
And you see people that go and get these things and they lose the weight, and then you see them a year later and they're right back where they started. And
Yeah,
like you said, they've damaged their metabolism. They could have damaged their heart or, other serious medical repercussions. So, what I'm hearing is bottom line, not a good weight loss solution.
definitely not what we're looking for, which is the end of dieting and the
Yeah.
beginning of healthy living and
Hmm.
sustainable health. So
Yeah.
those don't give you a jump start to get to those plateaus. They just don't. And I'm sad for us all because I would love a jump start on any kind of thing.
Yes, a quick fix would be so great.
Right.
So, what would you tell people then that are trying to seek out what they need? They feel like their doctor should be able to help them with this. And so, what do you recommend for them if the doctor's not the solution and the pills and shots are not the solution?
The solution is a team approach, starting with your doctor. Yes, you want that physical. You want to make sure that your blood work is the way it should be, that you don't have diabetes or prediabetes, something that would cause you to need a specific plan.
Hmm.
And you need that piece that was missing at the doctor's office, which is ongoing support. And unfortunately, you have to be an advocate for yourself. You have to seek that out go to the doctor with a list of specific questions about your health and how weight loss works and get educated because they do have some things to offer you.
Mhm.
Then look for people like Sarah Haas who can point you in the right direction towards that long term support and a structured plan that
Mhm.
works for you individually. Because what works for a 20-year-old is not going to work for a 42-year-old. It's
Absolutely.
got to be tailored to your life and the support that you actually have.
Mhm. Yeah, support is huge and that accountability. It can be isolating trying to figure this out on your own and trying to, try one thing and then another, and you don't have anybody giving you that guidance. And that's why I do what I do. And that's why I love it so much because it empowers people to take charge of their health and to get to where they want to be and create this healthy lifestyle that they're wanting and ending the whole diet cycle of thinking, oh, I have to be restrictive or I have to, take a pill or a shot or, because you don't have to do those things. You can live a practical, moderate, healthy life and feel great and be at your ideal weight and stay there. That's the ultimate goal is to get
It is
there and stay there. Awesome. Well, this
absolutely.
this has been very informative. I appreciate you being here so much. I think that all my listeners are really going to gain a lot from what you have shared with us. So thank you so much for being here.
Thank you. It was really fun.
And thank you all for listening. I hope this was super helpful for you. I know it was enlightening for me. And that is all we have for today. So I will see you next time.